Hey guys, this is Dr. Samir Islam. I want to thank you for joining me tonight. So tonight I want to discuss a topic about the brain-gut connection. I have a lot of people who ask me, when I get stressed, my gut seems to react, and why is that the case? And we know that there is a connection between the brain and the gut. And so tonight I want to discuss some of the options that we have for treatment. You may find that treating some of the issues with the brain may actually make your gut feel a lot better. So before we begin, let's talk about IBS. So IBS is described as irritable bowel syndrome. This is a chronic functional GI disorder characterized by abdominal pain with some sort of change in bowel habits over a period of time. The way we diagnose IBS is that we know that there's no actual structural or biochemical abnormality, meaning we can do scopes, we don't see anything wrong, we can do blood tests, they come back normal, we do a normal physical exam, we don't see anything that we can pinpoint and say, hey, this is IBS. And this is going to be frustrating for a lot of people. They're wondering why they're feeling so bad even though all the tests are normal. And that's because we know that IBS is a disease in which we don't actually see the actual cause, but we can determine the symptoms based on the clinical judgment that we have. And the way we have diagnosed IBS is that we classify it according to three main different groups. We have IBS-D, which is diarrhea predominant, meaning you have mainly diarrhea with pain. We have IBS-C, which means you have mainly constipation with pain. Or you can have a mixed presentation where you have a combination of diarrhea and constipation associated with pain as well. But the common theme when you have IBS is abdominal pain. If you do not have abdominal pain, it is not classified as IBS. Pain has to be a predominant component of the disease before we can diagnose somebody with IBS. Now, the difficult thing about IBS is that it affects more than the gut. I have a lot of patients who have IBS symptoms, but they're also depressed, anxious, or annoyed, feeling fatigued, and that in turn will make their gut feel worse, which in turn will make them feel more anxious. So it ends up being a very vicious cycle. And we have to somehow break that loop to make our patients feel better. So your brain and spinal cord are your body's central nervous system. Nerves, neurons, and neurotransmitters, which are chemicals that help the nerve signals flow from one neuron to another, run from your brain throughout your body. Those that run along your digestive tract, from your esophagus, through your stomach, to your intestine, to your bottom, are called the enteric nervous system. This is the brain in the gut. Your brain and belly talk to each other throughout this network of nerves. They respond to the same neurotransmitters or chemicals, and this may explain why emotional distress can manifest within the GI tract. This may also explain why when you're anxious, you may have diarrhea, or you're worried, you may have some bloating. It's this brain-gut connection that's through the neurotransmitters that causes these symptoms to occur. So for example, stressing about other things like having a speaking engagement can cause your GI tract to be revved up, and that in turn can make you more anxious. So it ends up being this vicious cycle between your brain and your body in terms of your anxiety, making your GI symptoms worse, which in turn makes your anxiety worse, which in turn makes your GI symptoms even more worse. The relationship between your brain and your gut is complex, with neurotransmitters or chemicals interacting between the two different areas. And this may explain why emotional distress can cause a lot of GI issues and why GI issues can cause a lot of emotional distress. So now that we know that there's some connection between the brain and the gut, there are some therapies that we can use to affect the brain, which in turn may help alleviate some of the gut issues. And I've used this for a lot of my patients. By addressing stress or by addressing some of the issues going on inside your head, we're able to take care of some of the gut issues and hopefully allow our patients to have better control of their IBS symptoms. This is a very easy and effective treatment that we have that does not involve any medical therapy to allow you to feel hopefully better about your gut. The first one is relaxation therapy. Progressive muscle relaxation and guided imagery can help reduce your body's reaction to stress. This training can help calm your body and mind and help you sleep better as well. Deep relaxation causes your body to release endorphins, which are natural painkillers, so that allows you to control your IBS symptoms better. This also allows you to calm your mind, which in turn will calm your gut. Cognitive behavioral therapy is a very effective, clinically proven treatment for IBS. This changes the way you think. And by changing the way you think and behave, this can improve your body's response to stress, including the stress of IBS. You learn coping skills such as focusing on the positive emotions, physical activity, and finding joy in the things that you normally like to do. What it basically comes down to is you change your brain, you change your gut, in essence, you'll change your life and you'll feel a lot better as well. and this has been shown in clinical studies to help improve IBS symptoms. Biofeedback therapy is also a very effective treatment that we have for our patients with IBS. This technique allows you to get feedback about a physiological function such as your temperature or heart rate, and then helps you to control it. With biofeedback, you can slow your heart rate and warm your hand when you're stressed. Another example involves patients with constipation or stool leakage who use the device to measure the strength of their pelvic floor muscles. By watching the device's measurements on a computer screen, the patients learn to relax or contract muscles to overcome their GI issues. This is a very effective treatment for heartburn, IBS, and diarrhea, and we use it a lot for our patients. You see what your body is doing, and you learn to control that. And by doing that, you're able to manage your IBS symptoms. So when would be the best option to use these therapies? Number one, if the medications aren't controlling your IBS. If we put you on some sort of treatment and you realize, hey, this is not for me, or it's not controlling the symptoms that I want to control. Number two is if you notice your stress makes your symptoms worse. If you find yourself anxious and that anxiety causes you to have more pain and diarrhea, this may be an option to use these brain therapies. Even if you prefer not to use medication, that is a very effective option. I have a lot of patients who want to control their thoughts through relaxation techniques or cognitive behavioral therapy. And this is very fine and effective for IBS patients. And if you suffer from anxiety or depression naturally, this may be a very effective option to control your gut. I have patients who have anxiety as their main issue, which can manifest as GI issues. And by controlling the anxiety and depression, you're able to control the IBS symptoms. So we do know for a fact that there's a connection between the brain and the gut. And we know that controlling sometimes some of the brain problems can really affect and improve some of your gut symptoms. I want to thank you guys for joining me today. I would encourage you to comment below and let me know what things you have done to help out with your IBS.